Hello dear students, in the previous class we discussed about the gastrointestinal agents. So in that I explained the first three main groups like acidifiers and antacids, and the third one is protective and adsorbents. Okay, and in this only gastrointestinal agents, the fourth main group is the saline cathartics. Okay, so in this saline cathartics, important examples which you have to give more concentration are here the sodium potassium tartrate, and also another one is the magnesium sulfate. So here the saline cathartics, so it involves mainly the laxatives, purgatives, and also the cathartics. So saline cathartics nothing but it involves the laxatives, purgatives, and also the cathartics. So in generally you may know that laxatives and also the purgatives. So here these are the drugs which will be preferred for the constipation condition, or these are the drugs which will be used to clear the bowels before any surgeries. Okay, so even these are used for constipation, even for the expulsion of the intestinal parasites. Okay, so those we will consider as laxatives. And here the laxatives only when these are used at the higher concentration or the higher dose, those will be known as purgatives. So okay, so laxatives and purgatives. So cathartics, so here cathartics also may be defined as those drugs which being about defecation. So here these cathartics are beneficial in the main constipation and for the expulsion of the intestinal parasites. Okay, so they may also be given for clearing the bowels before surgery. So therefore we can consider the basic difference between the laxatives and purgatives is the main dose, nature, and the mechanism of action of that particular drug. So that may consider as a laxative or purgative. Both of them function to ease the defecation and are administered either by the oral route in the form of the suspension, powder, or that may be via rectal route. Okay, so as enemas or suppositories. So through the rectal, here you can consider anus. So through the anus, so stool excretion organ, so rectal route, that suppositories will be inserted or enemas will be inserted. So otherwise the oral route, so orally you can take through mouth. Okay, in the form of the suspensions and also in the form of the powders. Okay, so these are the different dosage forms of the cathartics or laxative purgatives. And as I already told, the laxatives, when these drugs will be used in the high doses, those will be considered as purgatives. Okay, so these purgatives are they stronger than the laxatives, but actually they possess the considerably mild action than the cathartics. So finally these laxatives, purgatives, and also the cathartics, in normal habits the peristaltis causes this defecation. So in the normal habits peristalsis causes the defecation. So the peristaltic are the able to stimulate bowel and relieve its contents. So it is nothing but here contraction of the muscle will be more, the peristaltic motion. Okay, so normally take place about 3 to 4 times a day. So by ignoring the urge to defecate by voluntary or by psychological lead to the constipation. Okay, so constipation can also be brought about by many factors like a weakness. Okay, so because of weakness of the intestine and intestinal spasm, injury, or the use of certain drugs, and also because of diet it may occur. So in constipation, what will happen? The fecal material becomes very hard and dry. Because of this property, there will be a very difficult to excrete the stool. Okay, so that condition we will consider as a constipation. Okay, so in this what will happen? The fecal material become very dry and hard. So here these laxative and purgatives will be used. So lubricants, it acts as a lubricant type. Purgative provides the relief in the constipation by elimination of the bowel contents. Okay, even these saline cathartics will show their effect by the different mechanism of action. Okay, so here cathartics or the purgatives, generally they will act by the main 4 different mechanism. Okay, so in this what will happen? The first one mechanism of action may be by stimulant effect, and it may be bulk purgative, or it may act as a lubricant, or it may also act as saline cathartics. Okay, so in the first one, in this stimulants, the drugs or the chemicals acts by the local irritation or the intestinal tract and bring the stimulation of the peristaltic activity or the motion. As they act directly on the intestine and stimulate the peristalsis, they are termed as stimulants. Okay, here there is a stimulation will be there, so that's what they will be considered as stimulants. And now you can consider the herbal drugs like senna, rhubarb, and cascara, podophyllum, castor oil belongs to this class stimulants only. Or in pharmacognosy, we have studied all these crude drugs. Is it so? They will be act as an stimulants which will show the cathartic action. Okay, and next the second type of the mechanism is the bulk purgative. So here these are the agents which are able to increase the bulk of intestinal contents. Okay, so these are cellulose or the non-digestible type of the materials which swell the considerably when they wet, and here because of increased bulk stimulate the peristalsis. Okay, so directly stimulants will stimulate the peristaltic activity, it will show so peristalsis intestine, but here the purgatives will increases the bulk, because of that it stimulates the peristalsis. Okay, so here examples for the bulk purgatives you can give the methyl cellulose, sodium, CMC. Okay, and also the gum and bisapco. All these are the some of the examples which shows the bulk purgative property. And the third type of the mechanism of action is the lubricants in this. Okay, so lubricants in constipation, the content of the intestine become very hard because of the absorption of water by the body. There results the difficulty in cleaning of bowels. Okay, so substances such as the liquid paraffin, glycerin, mineral oil, etc. will act as lubricants and finally cause the smooth clearance of the fecal material. So examples are the, here you can give the liquid paraffin, glycerol, and the glycerin, mineral oil, which will act as an lubricants and finally shows the cathartic property or laxative property. And the last type of the mechanism of action, that is saline cathartics only. So these act by increasing the osmotic lead of intestine by absorbing the large quantity of the water and thereby stimulate the peristalsis. Okay, So purely absorption. Okay, so here purely absorbable cations like calcium, magnesium, and also anions like phosphates, sulfates, tartrate are contributing to this effect. So saline cathartics are the water soluble mainly inorganic chemicals. They are taken with the plenty of water. So this is helpful in restricting excessive loss of the body fluid. Okay, so this is helpful in restricting excessive loss of body fluid and reduces the nausea and vomiting. So the saline laxatives are relatively free from the side effects when taken for brief period. Okay, so patients on the low sodium diet should not use the sodium containing saline laxative. Okay, so contraindication may be said. So the patient condition is also very important while prescribing the cathartics. Okay, so patients on the low sodium diet should not use the sodium containing saline laxative like a hypertensive patient. Okay,